My name is Kathy Anderson. I'm the program coordinator here at Compass Nursing Arts. I'd like to welcome you to the orientation session. We're assuming that you probably have already completed and submitted your application, registration paperwork, documents such as TB test, flu vaccination, drug screen, background check forms have all been submitted. If you haven't done that yet, make sure to get a hold of the office so that you can get that paperwork in, because that is required for you to be able to go to clinicals. So either prior to the class or on the first day, you will have received a folder, and inside the folder is a lot of information, a lot of content on the course. Part of the information in the folder is also policies and procedures, and that's basically what we're going to spend a few minutes talking about. So the first thing that I want you to pull out of your folder is course description and policies. So first of all, we have a couple of different kinds of classes. We have traditional classes that are all in class with outside homework, and then we have hybrid classes that are partially online, and then some portion of it will be done in class also. So class work would be in the classroom, in the lab at the school, and then also in the clinical setting. Once you've completed the course, whether it be traditional or hybrid, you will have an opportunity to then take the state exam, assuming that you've met all the requirements, completely done. And we are a state test site, so you can test at our facility. So right now we're going to get into the policies. So our goal here at Compass Nursing Arts is to help you be successful. If you love to care for people, if you enjoy that personal interaction with people, you're going to love being a CNA. We wanted to help you deliver excellent patient care, and that starts with the heart. And hopefully you have that coming into class where you have the heart of just really wanting to help people. Let's get into student expectations. So we need you to wear scrubs to class, to lab, and also to the clinical setting. For the clinical setting, the scrubs have to be blue or any shade of blue, or a blue scrub top with black scrub pants. You all will be given a name tag that looks very similar to this, where you'll put your name on it. That way students will know, or residents will know how to identify you when you come to clinicals. We want to make sure that you know that we expect that your uniform will be clean, that you'll wear socks, that you're going to have closed-toe shoes. In the lab area, we do need you to hopefully have some kind of slip-on shoe for the lab portion of the course, because you'll be getting in and out of beds. You'll be each other's patients, plus we have mannequins too that you'll be working on in the lab setting. We want to make sure that you have a watch with a second hand, so when you do your state exam, which will be following the graduation from this class, it can be at our site. We are a regional test site. You can test anywhere you want in the state of Colorado. Most students prefer to test at our site since you will be familiar with the site. So Pearson VUE is the testing company. They require that you have a watch with a second hand. So those are relatively inexpensive. You can get them at like Walmart or Target. You also want to bring, as far as supplies, is a couple of pencils, a black pen, and a notebook to take notes in. Grounds for dismissal. Let's talk about that. You must have at least 75% over all of the material that you've done in class to be able to pass the course, and you must have at least 80% on the final exam. You also will be required to do a mock skills exam. That's where you'll be given 2 to 3 random skills, and then we will see how well you scored on that. So you want to keep that in mind as you're studying your skills. You need to be 100% attendance in all classes. If something comes up and you need a makeup time, talk to your instructor about that, or talk to me about that. We will need some verification as to why you need that makeup, and we will try to work with you to help you succeed in the course, but we also need you to put in the effort to really work yourself too. Let's talk about inappropriate school conduct. It is not appropriate for you to bring pets or children to class. No alcohol, drugs, or weapons of any kind are allowed on school property. We ask you when you're at the school to be respectful of the facility and also the equipment. So we don't allow students to bring anything into the classroom other than a water bottle with a lid on it. We like to keep the facility very clean, just like we would in a hospital or a healthcare setting or long-term care facility setting. We want to keep everything really clean. We want to make sure that you treat equipment carefully. So we have blood pressure kits, we have a Hoyer lift, we have a sit-to-stand, we have hospital beds. We have a lot of equipment that's rather expensive. Everybody wants to use it and be able to use it. And so if everybody's careful with the equipment, we'll have no problems. So please be respectful in that way. Cheating or stealing is an automatic dismissal. Your homework must be completed independently. Inappropriate language. A lot of students have some issues with language. One of the first things that you want to do when you walk into a patient's room is to not offend your patient. So clean up your language. No slang, no swearing. For example, some patients may be offended by saying, "Oh my God." So if you have a habit of saying that, break that habit. You don't know what is going to offend your patient, and it's all about them. It's not about you. You need to make sure that you're very, very respectful to your patient at all times. Confidentiality. So we all care about confidentiality, and you are required by law to keep records confidential. So that includes any personal information at all. That's why when you go to clinicals, we don't allow you to bring a cell phone into the clinical site. You have to leave that in your car or at home because we can't take the risk that you would use that cell phone in an inappropriate way. And most of our facilities have that policy for their employees too, so it's not an unrealistic policy. You've all heard of HIPAA, Health Insurance Portability and Accountability Act. Violation of HIPAA laws could cause you to have severe penalties, including possibly jail time. So be really careful to make sure that you keep your residents' information confidential. Let's talk a little bit more about some of the things that you may not realize about the course. Once you have finished the online portion, in-class portion, and lab portions of the course, you'll be allowed to attend clinicals. When you attend clinicals, you are attending as a student nurse aide. So you cannot practice, if you have any other certifications, you cannot practice other than just as a student nurse aide. We do have blood pressure kits that we check out to students. You will need to return those kits when your instructor tells you to, and for sure before you go to clinicals. If you lose that kit, we will have to charge you for the cost of that kit. We do like students to know how to take a full set of vital signs. The state requirements right now are that you can take an automatic blood pressure. We have added an extra level to that where we require you to also be able to take a manual blood pressure. Just remember that one of the most important things that we base our program on is trust. Trust starts with truth and ends with truth. So if you have any issues that come up, any concerns or anything, please come talk to me. The next form I want you to pull out of your folder is this one, which is the student agreement and course description policy. So you can go ahead, read each one, initial, and then sign at the bottom for that one. After that, we have the clinical practicum experience. So when you go to clinicals, it is possible that you could become injured. We have some very strict guidelines to avoid injury, but it is possible you could become injured, so we need you to fill this out and sign that also. Okay, I mentioned that when you are done with the course that you will have the opportunity to take a state exam and that we are a state testing site. So in order to get you into the system, we need you to look at this form, which is the Colorado Nurse Aid application process. Just read it really carefully and go ahead and submit that right away in an email so that we have your information already. We can upload you to the Board of Nursing and the Pearson VUE testing site and get you scheduled for testing. What will happen is You'll get an email back from Pearson VUE. In that email, there will be a link where you can click into there and go ahead and schedule your state exam. Okay, speaking about state exam, let's talk about a little bit the preparation for that state exam. So you have a Colorado Nurse Aid Handbook. Inside this handbook is all about your state exam. So it has in here the Board of Nursing number that you can reach if you need to talk to somebody at the Board of Nursing. It has Pearson VUE number, which is the testing company, if you need to contact somebody there. It also has all about the regulations related to state testing and what you can expect on test day. It has in here how they will do the exam, the different kind of exams that you can sign up for. We recommend that for the majority of students that you would sign up for written and skills together. It talks in here about testing locations, how to reschedule your exam if you need to reschedule your exam. Another portion of this booklet that's really important is these skills. So if you look at a skill section, you will see that there's some bolded areas for the skills. Those are considered critical. We are teaching you how to read these skills as if though it were a legal document, because that's how testers test you on these skills. They're very, very particular. So anything that is bolded, if you do not pass every single little piece of that sentence that is bolded, you will fail the entire skills portion of the exam and will be required to come back and pay again for it and take the exam again. So we work very hard to get you prepared for this exam, and reading the skills book is a big part of that. You'll learn more about that when you get into the skills lab. So speaking of skills lab, we have this sheet, which is how we check students off on skills. So we have every single step numbered, and your instructor will evaluate you, your classmates will evaluate you. You're going to learn to think like a tester so that you can be very successful in passing the skills. So there's a total of 22 skills. This is all represented on here. You'll want to make sure to fold this in half, put it in your skills book, and then you're ready to go into the lab. Make sure you put your name on the front of your skills book. Going along with skills, one of our instructors created for us a list here of all the supplies that you will need for the skill. This is really important for you to learn, because when you know the supplies, you know the skill. Basically, when you are gathering your supplies on test day, you're reviewing what your supplies are, and it's a great preparation for being calm and just moving in and getting that skill done while the tester is watching you. So learn your list of supplies. I mentioned that we require you to know how to take a manual blood pressure. So prior to going to clinicals, we require you to know how to take a full set of vital signs. So this sheet here is going to help you just record the vital signs that you're taking. It's just a worksheet. If you have any problems with taking vital signs, we're going to want to see this worksheet just to make sure that you truly were using those kits and practicing those vital sign skills outside of class. Okay, and every class will have an outline that will have the dates and everything on it that you need to complete homework to just keep you organized and on track for class. If you have any problems or concerns, please talk to me. We're happy to try to help students. We just want you to have a great work ethic and also putting in at least as much effort as we are to help you be successful. So let's just double check here and make sure that we got everything done. So we talked about the course description and policies. We talked about a student agreement. You signed that. Your clinical practicum, you should have signed that. Your nurse aid application process, we talked about that. We talked about the outline that will have your due dates on it. Let's talk about our file here. So when you come to class, you'll have a student number and a file folder that is kept on site at the school in a file box in the classroom. So inside this file are two documents that have to remain at the school. One of them is called the Clinical Skills Checklist. So this will have all the information that you will be learning in class. Not all of it, but a lot of it. So you're going to go ahead and sign off here, date, instructor's initials, you'll leave blank, and then your student initials. These first 3 columns are what you do while you're at the school setting. The next 3 columns are what you do when we get to clinicals. Make sure you put your name on every page, and make sure that you use black ink when you're filling out this document. The other document in here is classroom attendance. So the Board of Nursing has a minimum regulation for CNA training, and we have to keep careful tabs of your attendance in class. We ask that you treat this like you would if you were working for an employer. So if for some reason you're stuck in traffic, or you got up one morning and you had a flat tire or something like that, call us right away. We want you to be professional in the way that you approach this class. So when you come in, you're going to go ahead and sign off on your attendance sheet, put your name at the top. Go ahead and write the time that you came in and the time that you exited each and every day. And then at the bottom here, we'll have you put down the clinical location, and also go ahead and sign the form so that we have this as part of your permanent record. Speaking of records, we follow the Board of Nursing regulations where we shred all of your information at 2 years after you have finished the course. So just keep that in mind. A lot of times students will contact us and ask us for certain documents or things beyond 2 years. We will only be able to identify that you were a student at one point at our school and approximately about when you were a student, but we will not be able to provide you with any other information. So if you need copies of any of the things that you turned into us, make sure that you have the office make you a copy before you graduate from the class so that you have that paperwork already. We talked about the file, clinical skills checklist, checklist name tag. The last thing I want to mention is parking. So we have a front lot for parking that has about, 13 or so spaces. We also have a back lot for parking. So you can park in the front lot. Make sure that if you park in a spot that is along the alley, notice that on that stopper of the parking spot, it has compact on it. That means only compact cars can park there. So if you have a large vehicle, you're going to need to park in the back lot. Make sure you do not park next to any neighboring businesses, especially there is a small business near us, the shoe repair place, that sometimes students will park there. Do not park there. Do not park near any houses. Make sure that if occasionally we will have more students than we can fit in both the front lot and the back lot, in that case, we will need you to park in public parking. So behind the back lot on the south side, just one street over, is public parking, a couple of public parking places. So a whole lot for parking. So make sure that you park there if you can't park right into one of those lots. If you have any other questions or anything, I'm in the office a lot. Stop in and say hi. And I just want to thank you again for taking the course and welcome you to Compass Nursing Arts.